But legally, we absolutely can see those patients, and the VA has to pay us for them. So, my contract with Optum, this is an issue with your contract with Optum and between Optum and the VA. We are not a counterparty to that, right? That's a you problem, not an us problem. We can legally see those patients, and you have to either process the claims or the VA has to decide that somebody else is going to process the claims. But it's my understanding, Optum processes the claims for the entire VA community care network. Is that correct?
That's correct, but not in this scenario. Your battle is going to be with the VA, not Optum. We don't have a contract with you for what you tried to do. I'm not saying you're not legally that you can't see the veteran. By all means, you can definitely see the veteran. But in terms of the contract you have with us, you didn't get a prior authorization for the services, and you weren't contracted for a Compact Act, which in terms of Optum Behavioral Health, if you wanted to get paid by us, you had to have a facility contract, which you would have not been set up for.
So you're claiming
how you are.
So to be clear, I mean, have you read this law?
The law doesn't matter. It's how you're contracted with us. You're not going to get paid by Optum.
Optum is acting as a third-party administrator for the VA in this context.
If you follow the appropriate process for how you're contracted, yes, but you didn't follow the appropriate process. You taking in that veteran is totally fine. I'm not disagreeing with you in how the law works. The problem here now is you're trying to get Optum to pay for services that you weren't contracted to provide.
So to be extremely clear, we are 100% contracted to provide these services. We have a contract with you, which has the standard VA rate card for these services. You're just claiming the way they walked in the door is not covered by your contract with the VA or with our facility. Is that correct?
Well, it's a combination of the way they walked into the door and you guys not getting prior authorization. Regardless of how they walked into the door, it really wasn't.
Good sir. What is your understanding of the law as it relates to a veteran's ability to seek care for a suicidal crisis?
I don't know where else to go with this conversation other than the fact that you're not going to get paid by Optum. I can tell you that right now.
Sir, I'm not going to get paid by Optum is a nice stance for you as an employee of Optum. You realize this is not Optum's money, right? The payer here is the Veterans Administration. The third-party administrator is Optum as in its role as a TPA, right, to process a claim. You're claiming that Optum, the third-party administrator, is refusing to process claims. Please confirm my understanding is correct, but you're refusing to process claims for suicidal veterans who we both agree are covered under the Compact Act and its subsequent amendments, but you don't want to pay at all ever if the person comes in because they're suicidal, because we're not an emergency room, despite the fact that the law says that any healthcare setting is able to provide this care and can and should be paid by the VA subsequently if it's a suicidal crisis, ?
No, all I'm saying is based on how you're contracted and the fact that you didn't get a pre-authorization and the fact that you're not able to take on emergency referrals, which is what the Compact Act falls under for Optum Behavioral Health.
So what is your understanding? What is your understanding as the way veterans are supposed to obtain their legally provisioned care, if not through a facility that submits a claim to Optum?
I mean, your battle is most likely going to be with the VA. If you want to try to get payment from them on this situation, you certainly can try. But in the current moment, you provided 30-something rounds of TMS.
Yes.
And also had a veteran walk in under the Compact Act. Neither of them you had referrals for.
Right, because the Compact Act provides
a referral to you, which is.
So the Compact Act provides for care without that referral. They can walk in if there is suicidal risk. as determined by no criteria the VA was willing to specify, and the opinion of a medical professional, and in this case, we documented the suicidal risk and the reason we thought the patient had it, which was elevated scores on question 9 of the PHQ-9 about suicidality, and the concern of the spouse of the individual who collateral was also obtained from, that this person was at urgent risk of suicidal behavior, and thus we used an FDA-approved treatment for their severe depression, which, by the way, remitted. This was an effective treatment. And you're telling me that Optum never submits this. Are you familiar with any way a claim could be submitted to the VA if not through Optum Behavioral Care?
Yeah, I to be honest, I don't know if this conversation is going to go any other way than what you're imagining, but the Compact Act has been out for years.
Yes. Yes,
and I can just tell you right now, we have never had an outpatient provider try to bill a Compact Act nor get a Compact Act referral.
Like, I understand that you're not familiar with the updates in the regulatory environment like I am. But what I'm telling you is that last year, there was an update to the Compact Act because the VA got sued for its inability to provide care to suicidal veterans, lost, and as of terms of that settlement, they updated this such that outpatient providers like myself could submit bills for the care of veterans under the Compact Act. So your lack of familiarity with the updates in the regulatory environment are not my problem. They are not the problem of this veteran. They will become the problem of Optum Behavioral Care, I imagine. But just because no one's done it doesn't mean it's not the law. So does Optum Behavioral Care process all claims for the VA under the Compact Act, to your knowledge?
With a referral.
But you understand that the Compact Act provides for care without a referral. Like explicitly it says that.
No, it gives you the ability to admit a veteran and then reach out and obtain a referral within 72 hours.
So I'm gonna read you the text of the law because I think it may be worth familiarizing yourself with what it actually says.
I'm sorry. At this point, honestly, you don't need to read me the law. The law is not going to help us in this situation. You're more than welcome to speak with my director.
Yes.
Or
can you just do that right now?
Matter on this option. Absolutely not right now. I'll contact her and see if she's able to call at another point. But at this point, the overall issue is there's no way for Optum to pay you without a referral, and you never obtained one.
Yeah, because we legally by law don't have to do that. So why would we go and do a thing that isn't part of the law? You're not interested in understanding the law.
Because it's a part of the contract.
But the law supersedes your contract.
You're mixing two legalities. I don't think.
You're making a contract law claim.
To be honest.
Well, I mean, what's your training, by the way, good sir?
My training's irrelevant. I'm just telling you how the network
I'm asking you a question.
I'm asking you signed to be a part of.
I did. What is your training and level of licensure?
That's irrelevant.
I'm asking a question. You're an employee of Optum.
Contracted.
What is your level of licensure?
Let me just jump in. Austin, what's the name of your supervisor? Austin, what's the name of your supervisor?
No, Ben. At this point, I'll email you. I'll have.
Austin,
you guys.
please.
We're gonna.
Austin, I can get the name of your supervisor, not the email, just the name of your supervisor.
No, I will email you that information. At this point, I'm going to end the call. I'm going to reach out to her and discuss because this call.
And to be clear, to be 100% clear, good.
Oh God. He proceeded to claim he didn't even remember that I had asked them the question of what the law said, because apparently United Health Group subsidiary Optum Behavioral Care is employing people with profound problems with their short-term memory. Or he doesn't know what he's talking about. Good day.